Welcome to the symposium organized by the Asian Society for Pediatric Infectious Diseases. And my name is Usati Siakon. I am the Executive Director of Tropical Medicine Cluster, Chulalongkorn University, and I will co-chair this session with Dr. Nobuhiko Okabe from Japan. And Dr. Okabe will be the one who introduces all speakers. Dr. Okabe, the time is yours, please.
Okay, thank you very much. Good morning, good evening, or good afternoon, everybody. So this is a session for the dengue fever. And the first speaker, I would like to introduce Dr. Ichiro, President of the National Institute of Infectious Diseases. But now he is the honorary member of NIID, and he's an expert for the particularly viral and particularly for arbovirus diseases and the dengue fever. So Dr. Kurane, please start your presentation. Thank you.
All right, thank you again. The title of my talk is Dengue in the Midst of COVID-19 Pandemic. I'll just give you some basic information just for the case that there are some audience who may not be familiar with dengue. Dengue, about 4 billion in over 100 countries are at the risk of dengue virus infection, and the reported number of patients have been increasing. Endemic regions have been expanding. There are many imported cases in non-endemic countries, and there are 4 serotypes of dengue virus. This slide shows the infectious cycle of dengue virus. Mosquitoes, infected mosquitoes bite humans, and this human, he or she, will be infected and then transmit the virus to mosquitoes. The important fact is that dengue the virus is transmitted from infected asymptomatic and symptomatic humans to mosquitoes. So someone who are asymptomatic can still transmit the virus to mosquitoes. And there are 2 vectors for dengue virus. One is Aedes aegypti and the other Aedes albopictus. Aedes aegypti, primary vector of dengue. Aedes aegypti live in where there are people in and around homes. And this the mosquito can make a big epidemic. And Aedes albopictus live in urban, suburban, and rural areas, and it is closely associated with vegetated areas. Internationally, the Aedes aegypti spread very widely and spreading wider and wider. And then, okay. What kind of question do we have? Let's say there are various questions, but for example, effect of COVID-19 pandemic on the number of dengue cases in dengue non-endemic countries and dengue endemic countries. The other question would be, as already presented, clinical aspects and socioeconomic aspects, also antibody-dependent enhancement in because this phenomenon, antibody-dependent enhancement, has been most profoundly studied in dengue research. Then I move to the question whether dengue virus non-endemic countries, how about the number of patients during the COVID-19 pandemic. This shows the results in Japan. The blue bar shows the imported dengue cases, and the purple bar shows the domestic infection. And as before I explained this, in Japan we have Aedes albopictus and no endemic dengue virus. So most of the patients are imported cases. If you see the imported cases of 2020, we have only 45 compared to other years during the past 10 years, the number declined dramatically. Now, if we see the weekly numbers of dengue cases in Japan during 2019 and 2020, and we had about 10 to 20 weekly cases during 2019 and until the WHO COVID-19 pandemic declarations. And just after that declaration, Japanese government declared state of emergency. So the number of dengue cases reported per week are almost zero. If you see which countries, the countries where imported dengue cases left before returning or entering Japan, you have many countries in Southeast Asia or other tropical, subtropical regions. So the previous results indicate that this decline is not because due to the decline in one countries, and this is more of the worldwide trend because the travelers do not come to Japan. That's probably the main reason. And how about the situation in other countries, other non-endemic countries? And there are very many reports, I believe, that I just pick up some. And Korea, China, Taiwan, Australia, they were non-endemic countries. And in those countries, the number of dengue patients declined dramatically. And also Kaohsiung City in Taiwan, Yunnan province in China, for example, more rural areas, the number of the imported cases to the city or this province has declined dramatically. If you see the column of increase, I couldn't find any paper. This doesn't mean none, but I couldn't find it in non-endemic, the paper which indicates the increase of the dengue cases in non-endemic countries during the COVID-19 pandemic. And how about in endemic countries? This is the result and summary. And there are both the papers which indicate both increase and decrease. For example, in increase in Peru or Thailand, decrease here in Malaysia, Sri Lanka, Singapore, the region of Americas, and Guangzhou province, China. These areas, these countries are dengue endemic countries, and these two countries are dengue endemic countries. But depending on the countries or areas, the number of patients are increased in some and decrease in others. The number of countries here has more in decrease, but I do not think this simply indicate that more countries decrease in more countries, in less countries increase. That may not be the case, but I just show the papers already published. And this is the summary reported I saw in PAHO epidemiological update. If you see the number of dengue in the blue bar here in 2020 and 2021, the numbers of dengue in blue bar somewhat decreased compared to other region, the years. So the conclusions is that effect of COVID-19 pandemic in non-endemic countries is that decrease of imported cases, probably by restriction of international travel and severe regulation in domestic, decrease of epidemic original originated from imported cases. So this means that if you shut the country, imported cases do not come in. That means that epidemics from originated from imported cases does not occur. This clearly indicates that the results. How about the effect in endemic countries vary? That varies. Decrease. People stay at home and infected people do not go out as transmitters. So probably people tend to stay at home, and decrease in human, that this lead to decrease in human, from human to mosquito transmission. That's probably the main reason. How about the increase? Probably due to the decreased level of mosquito control. That means that will lead to the increase in mosquitoes and increased mosquito human transmission due to the increase in mosquito numbers at around home would increase the number of dengue cases. But it is likely that the results we saw or result reported mainly due to human behavioral change by play induced by countries' decisions or induced by their own control of their everyday activities, and probably that play a very important role. But there are factors that may also have contributed to a change in the number of dengue cases, what we saw, because the study is just 1 or 2 years. In addition to human behavior changes due to COVID-19 pandemic, and it's possible that major serotype may have changed in the region, virulence of major dengue strain may have changed, or climate difference may have affected, because we see only the result of the 1 or 2 years, and these scientific part are not usually included in the report, because in most of the report they rely on the number of cases. So therefore, further studies are needed to understand in detail the mechanisms of the efforts of COVID-19 on dengue. I believe that human activities, human trend, and how to act, or how do we behave, are the major factors. But we always have to check these things too, as well as the number of the reported cases. Thank you very much. I'm sorry for inconvenience for you to see and listen. Thank you.
First of all, I would like to thank you, the organizing committee of the ASPID, for inviting me to sharing my topic, the dengue and the COVID-19 global troubles. This is my conflict of interest. I do not have any conflict of interest. And this is the outline of my presentation. I think I have 3 major aspects that I would like to discuss today, starting from the clinical manifestation and diagnosis that sharing between dengue and the COVID-19. The first aspect is the clinical aspect. And the importance of this part is if we misdiagnosis of the COVID-19 patient as a dengue infection, the consequence will we may cause the outbreak of the SARS-CoV-2 more in the hospital or community. The second one is if we may delay our investigation, like a chest X-ray, and delay antiviral treatment that should be started, and also the steroid therapy. And we may put the patient in the risk of the ARDS and the cytokine storm. Or the other way, if we misdiagnosis of the dengue infection as a COVID-19 infection, we may put the patient, the dengue patient, into the unnecessary exposure to the SARS-CoV-2 and also exposure to some unnecessary treatment like antiviral therapy and the steroid. And we also may put the patient in the risk of dengue complication like bleeding and organ failure. When we look into the data of the report of the clinical manifestation of the COVID-19, As you can see that many of the symptoms can sharing between dengue and the COVID-19, like the fever, fatigue. This kind of the clinical is quite a non-specific and can be found in many, not only the dengue but also in the viral infections. And also, when we look into laboratory, many of the laboratory of the COVID-19 patient also show some share common feature, including the low white blood cell count and also the thrombocytopenia. Not only the laboratory, some clinical manifestation like cutaneous manifestation that quite common in the COVID-19 also show some manifestation of the dengue infection like petechiae. Recent report also of the skin manifestation in the COVID-19 from the tropical area also show some interesting finding like urticaria or the NP rash. And also another report from Chulalongkorn University show some cutaneous manifestation that sometimes can also be found in the dengue infections. The second aspect that we'd like to discuss is the misdiagnosis due to the serology cross-reactivity. The cross-reactivity may be between the anti-dengue virus antibody and SARS-CoV-2 virus antibody, and also in terms of cross-reactivity of the antigen between because of the similarity of antigenic of the SARS-CoV-2 and the dengue antigens. The first report that make the world recognize and concerning about this issue is from the Singapore that report the first 2 cases of the patient who was misdiagnosed at the beginning as a dengue infection, but returned back to the hospital because of the clinical worsening on the subsequent day, and finally was diagnosed COVID-19 by using the PCR. Both of the cases show the quite a similarity of the symptom of the dengue infection, and both of them has a rapid test of the dengue IgM positive, but however they return to the hospital because of the worsening of the symptoms. In terms of the serological assay, you can see that this is the structure of the dengue infection, and this is also the structure of the SARS-CoV-2 virus. And in this slide, we show that the size of the antibody, the rapid test that available in the market, binding both in the dengue and the SARS-CoV-2. Most of the rapid test to detect the SARS-CoV-2 try to detect at the receptor binding protein or the RBD. In terms of the rapid test of the dengue, most of them try to attach at the envelope protein or the NS1 antigen. Another report that try to show the potential antigenic cross-reactivity between these 2 syndromes is from the CID. In this study, they derived the blood sample from the acute dengue infection. As you can see that some of the patient who have the positive dengue infection also has the positive for the rapid test for the SARS-CoV-2 can be up to like 22% in some specific tests. When they're using the in silico protein structure analysis, they try to find the similarity between the SARS-CoV-2 and the dengue virus, and they found some similarity of the structure of the protein and also in the SARS-CoV-2 at the region of 6LVN change and the NS1 protein of the dengue virus. So in conclusion from this study, they show that with the in silico technique, they can show even this is like a computational analysis, there are the potential some specific antigenic cross-reactivity between these 2 diseases. So in the future research, we may try to prove the concept, the cross-reactivity between these 2 diseases, We also need to more understand about this antibody can protect or can be the immune that can protect the worsening of the disease, or it may be the cross antibody may worsening of the disease, like via the mechanism of the ADE. We still don't know this one yet. And also in terms of we found in terms of the structure that shows some similarity, but in terms of the functional, this is need to be more study. For example, in the patient who have of the SARS-CoV-2 virus who have the antibody in the plasma, we may doing some future research try to show this antibody can protect dengue viral infection in the future. On the other way, if we get the sample from acute dengue infection, we may look into the plaque neutralizing assay for the SARS-CoV-2 to look for that this antibody of the dengue can protect the SARS-CoV-2 infection or not. We still do not know this one yet. Another aspect that interesting and may share common between COVID-19 and dengue is in terms of the pathophysiology. In this regard, you can see that in dengue hemorrhagic fever, they have the plasma leakage, thrombocytopenia, and coagulopathy. In the same time, the COVID-19 also share this common feature also by increased this vascular permeability, presence of thrombocytopenia and coagulopathy. Plasma leakage in dengue infection, we know that is from the direct by the viral invasion and also from the immune mediated and cause endothelial injury. And one of the feature of the plasma leakage is coming from the evidence of the cytokine storm. And also in dengue, we know that this very in some certain cases there has a complication from the hemophagocytosis complication as report from these two series. And we know that in the COVID-19, the SARS-CoV-2 virus can also cause a cytokine storm. And we know that in the SARS-CoV-2 virus, many features of the COVID-19 pneumonia also may be related to the same mechanism of the dengue virus induced hemophagocytosis that we call the macrophage activating syndrome. And this is the cytokine panel that derived from the severe COVID-19 pneumonia that also shows some specific cytokine profiling or cytokine storm. Recently, our group also demonstrated the evidence of the endotoxemia in severe COVID-19 patients in the intensive care med experiment. In this slide, we demonstrate that the endotoxin might play another role of the triggering agent to cytokine storm in COVID-19 infections. And in dengue infection, recent report also in the Journal of Clinical Virology show the evidence again of endotoxemia or lipopolysaccharide also in the severe dengue infection. So as you can see that many of these kind of the post-immune response show the common feature. In terms of treatment, we know that the mainstay of the COVID-19 is including treatment management and supportive care and specific antiviral agent and potential treatment like a steroid. What about in dengue? Until the present time, we still don't have any specific treatment. Free therapy is still, and the supportive care is still the main management of dengue infection. But with the current knowledge of the COVID-19 treatment, we may find another or the potential treatment for the dengue infection, especially the role of the steroid and the monoclonal antibody. We know that in the COVID-19 infection, we have when they progress, we have with the extensive of research during the past 2 years, we know that the steroid can be the treatment of choice, and we can still use some additional anti-inflammatory drug to control the inflammation if the disease still progression. And this is a study of the steroid in the COVID-19 that published in the New England Journal of Medicine, that the patient will get the benefit of this by if they requiring a mechanical ventilation support or oxygen therapy. And also another anti-inflammatory agent, tocilizumab or IL-6 inhibitor, also showed a positive result in the patient who significantly of the hypoxemia and show the evidence of the hyperinflammation like a high CRP. So with this knowledge, we may looking for the new therapy for the dengue infection. The corticosteroid is not a new issue in the dengue infection. Many investigators in the past try to apply this treatment in the various stage of the dengue infection, from early stage, intermediate, and the late stage. And this table summarizes the using of the corticosteroid at the early stage, in the intermediate, and in the late stage. Unfortunately, with the current evidence, we still could not find the market obviously benefit of this kind of the treatment. One of the thing is maybe we start the treatment too late, and also the number of population and the quality of the study is still quite low. Another potential treatment is a monoclonal antibody that has been extensive study in the field of the COVID-19. And as you may know, some of the specific monoclonal antibody show positive results in the patient who don't have any antibody response to COVID-19 infections. And recently, this is another potential treatment of the dengue infection, as shown in this study that published in Science, that show the protective potential of the monoclonal antibody to the NS1 protein. And this is the structure of the monoclonal of antibody to NS1 protein of the dengue virus that show the protective effect. So this kind of two treatment may be the future treatment for our dengue infection, but we still need to having better study design in terms of the to answer the timing and who will get the response, what is the dosage, and how often that we should apply this anti-inflammatory drugs. So in conclusion, COVID-19 shared a common clinical manifestation with the dengue infection, and also including cross-reactivity of the antibody and the rapid test result. The cytokine storm is a common feature in both disease, and with the current knowledge and advance in the knowledge of COVID-19, that might also improve our treatment for our dengue infection patients in the future. Thank you very much for your attention.
Okay, thank you very much, Dr. Nakatai. Very nice presentation, and I'm very so sorry for our management. But I'd like, time is very short. Thank you very much. But I'd like to move Professor Suri.
First of all, I will express my thanks to the organizing committee for this opportunity to talk about the prevention and control of dengue and COVID-19. This is my disclosure. I have no any disclosure, and this is my layout about the dengue, reported cases, goal of dengue control, and what is during the COVID-19 pandemic, and syndemic dengue and COVID-19, followed by the conclusion. We know that dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi-urban area, and the global incidence of dengue was grown dramatically, with about half of the world's population at risk. And we know that generally 80% is mild and asymptomatic. The dengue prevention and control depend on the effective vector control measures. Sustained community involvement can improve vector control effort substantially. At this time, WHO reported the number of dengue cases reported increases very much, 8-fold over the last 2 decades, and reported that between the year 2000 and 2015 increased also very much and affecting mostly younger age group. And the total number of dengue in 2020 and 2021, as well as for reporting death, is also decreased However, the data is not yet complete, and the COVID-19 pandemic might have also underreporting in several countries. You can see that dengue affected in several countries. In 2020, reported that many countries, particularly in Asian countries and South America, was affected very much about the dengue infection. And we can see the high number of cases were reported in Bangladesh, Malaysia, Philippines, and Vietnam in the Asian countries. This is the strategy of prevention and control, content of prevention of mosquito breeding, personal protection from mosquito bites, community engagement, and active mosquito and virus surveillance. And the point of importance is the preventing mosquito from assessing its laying habitat, using the personal household protection measure, education to the community on the risk of mosquito-borne diseases, and active monitoring and surveillance of vector abundance. And this should be combined with clinical and environment surveillance. The WHO in 2020 is the roadmap of the neglected tropical disease 2021 up to 2030. They stated that there is a critical action. The first one will be develop prevention vaccine for all at risk population. And the second one, further develop of evidence based on effectiveness of vector strategy. And the last one is collaborate with environmental sector and engineer to reduce mosquito habitat. The important one is also the vaccine, dengue vaccine. And the WHO position paper on the live attenuated dengue vaccine, CYD and TDV, stated that the pre-vaccination screening is the recommended strategy. But it's required careful assessment at the country level, including the sensitivity and specificity of available tests and of local priority, of course. And dengue epidemiology, country-specific dengue hospital rate, and affordability of both CYD and TDV, and the screening test is very important clue. And the last one is about the vaccination should be considered as part of the integrated vaccine prevention and control strategy. To reach the target of WHO, we conducted the study of the efficacy, the Wolbachia infected mosquito deployment for the control of dengue. This is held in the Yogyakarta city in Indonesia, in the urban area. And we divided by two clusters, intervention cluster and control cluster. And what is the result? In the incident of virological confirmed dengue and hospitalization in virological confirmed dengue seem to be the intervention cluster is less than control cluster. And the important one is the protective efficacy of dengue infection was 77.1%, and protective efficacy of hospitalization was 86.2%. And we can see here that the WHO Director General targeted the dengue control. We must reach the zero death in 2030. So we must do seriously to reach this target. And now we come to the dengue infection during a COVID-19 pandemic. We can see here the figure of chain of infection. It depends on 3 points here: the susceptible host, source and reservoir, and modes of transmission. And in the dengue, there is 3 determinants that follow the chain of infection. The first one is the virus itself. We know that dengue 1 up to dengue 3. And the host, we have man and mosquito. This is the very important one. And the environment determinant is either abiotic and biotic. Yes, this is the incidence of dengue and SARS-CoV-2 in several countries. You can see that if the incidence of dengue virus increasing, you can see the SARS-CoV-2 is very low incidence. And when the dengue infection come down, we can see that the SARS-CoV-2 incidence come up. We don't know yet what is the reason of this. Is there any interaction between the two viruses? I think it's need to be studied further. But you can see here the data from several countries in Asia. Indonesia and the Philippines are experiencing outbreak of the coronavirus and dengue fever simultaneously. Either in Malaysia and Thailand, there is increasing in dengue, but it's very low incidence on COVID-19. In Singapore, it's just managed to regain control of COVID-19. The data came from July and August in 2021. This is reported from Brazil. From more than 2,000 participants with COVID-19, 50% reported previous dengue infection. And we must pay attention without those without previous dengue at a higher risk of death in 60 days of follow-up. Another hypothesis is for sharing the pathophysiology between dengue and COVID-19. We know that we have what is the basic pathophysiology of dengue infection. There are plasma leakage, thrombocytopenia, and coagulopathy. Maybe there is the same pathophysiology in COVID-19, but it's still the link is still a question mark and should be further studied. This is the infographic from the made by WHO. They said that there is three important points. The first one, if we live in the area with the dengue infection and during the COVID-19 pandemic with the fever more than 3 days, it should be observation in clinical and do the lab testing. And the other one is if the subject has a chronic condition or the subject more than 60 years of age, it should be pay attention because they will have the severe dengue if they are attacked by SARS-CoV-2. So what are some preventive measures for the COVID-19? We know that preventive measures including physical and social distancing, and also the use of face masks or covering has been recommended in public setting to minimize the risk of transmission. I think the use of face masks is very important to be information. And how the use of mask. The important thing is it should be fit in my face. It should cover nose and chin, and also the filtration. It should be made from the good material, and breathability is also we can. If we use the mask, we can breathe properly. So these 3 points will give the optimal performance. Mask use function to prevent, suppress transmission and save lives actually. And the use of mask alone is not efficient to provide an adequate level of protection against COVID-19. This is a normal part of being around other people. And remember that the appropriate use, storage, and cleaning or disposal of masks are essential. And what are some social distancing methods to prevent the spread of COVID-19? Yeah, the method include quarantine, travel restriction, and closing the schools, workplaces, stadiums, theater, and shopping centers, of course. And the individual may apply social distancing method by the staying at home, limited travel, avoiding crowded area, using the contact greeting, and physical distancing themselves from others. This is the last two slides. I stated from the Symposium et al. About the pandemic-associated mobility restriction could cause increases in dengue virus transmission. So the implementation of the action to prevent one disease on another concurrent disease is very important. A holistic approach to infectious disease mitigation is needed to retain the positive effect of lockdown of disease like COVID-19, influenza, and also pneumonia, while mitigating the negative effect on dengue, malaria, and tuberculosis. The other important one is the vector control activity, which people can do themselves in their own homes, such handling over-the-counter and insecticide treatment should be encouraged and supported during lockdown. Whenever there is a risk of dengue virus transmission, effort must be made to avoid disrupting effective control practices and provide carefully planned alternative means of making interventions possible. And the last one, more communication, more creativity, and intersectoral collaboration. On the conclusion, the strategy of prevention and control of dengue infection, as well as COVID-19, have already established and implemented in all countries. To reach a zero death of dengue in 2020 or 30, the prevention and control of dengue should be strengthened and done seriously. And during COVID-19 pandemic, attention should be made, particularly in areas that dengue infection is endemic to. Thank you for your attention.
Even though we have some mechanical problem, so still we have the 5 minutes more or some, and I'd like to give this microphone to the Professor Yusa for the Q&A or final session. Professor Yusa, and it's over to you.
Yes, Professor Kurane, may I ask you first question?
Sure.
About the COP26. You have heard about that meeting in Scotland, that they try to do the best.
Yes.
Yes, they try to do the best for the climate changes, and it should be happen full swing on 2030. What do you think? Will have some impact on dengue?
Well, for example, let's say, let me answer you on base of Japan's situations. The Aedes albopictus, the hatching areas of the Aedes albopictus are going northward and will soon go into Hokkaido, the northernmost island. So in that sense, to prevent, and it depends on the temperature itself. So in that sense, if we keep the temperature within a certain degree, the epidemic of the dengue may not be as big as we may afraid. But the things may not be that simple, because temperature alone, in addition to temperature, there would be a rain or etc. and the places where they hatch it. So things will be much more complicated.
Yes, but
Thank
we
you.
still
Yes.
hope for the best. Is that
Yeah,
right?
sure. I hope
we hope for the best.
Yes.
And I would like to have the next question to Dr. Nathachai, because you bring this up about the COVID-19. And the question is, do you think previous COVID-19 may lead to a more severe course of primary dengue? What do you think?
Thank you, Professor Usa. I think we still could not answer this important question. Like Professor Kurane mentioned, that we still need more further study in the short term, also in the long term, on this topic, because I am completely confident that in the near future we're gonna have the patient who also have the previous COVID-19 and cause a dengue infection. On the other way, we're gonna have the patient who also have COVID-19 dengue infection after the COVID-19 also.
That may be the postulation to make the researchers busy, so you can have some good research questions. So the next question go to Professor Suri, and do you use steroid in dengue patient sometime? Because the person said they try in some patient with refractory shock and do not respond to vasopressor therapy, so they try steroid. What is your experience, Professor Suri?
As far as I know, we have not used the steroids in dengue, except in the encephalopathy without bleeding, hemorrhage. Sometimes we use the steroids because we know that there is an edema in the cerebral tissue. So, but we should be careful if we have the very low thrombocytopenia and also the hemorrhage. That is our experience, Usa. Thank you.
Yes, thank you. So may I ask the experience from our intensivist, Dr. Natachai, what do you think? Because, you know, I've heard that you have done a study about the cortisol level in dengue patients. Yeah, would you like to share?
Thank you, Professor Usa. Yes, our group have been studying the role of steroid in the severe dengue infection, and now the study is under review. We found that the steroid level can be one of the good predictor of the severe dengue infection at the time of the patient hospitalization. And we have shown in that study about the cutoff point around 17, maybe a good cutoff point to for the predicting severe dengue. But in the next step, that should start the steroid in the dengue infection or not? I think this question is still debatable. But we found some signal from the prospective observational study that we have done, and we found the role of the steroid might be a good marker to predict severe dengue infection.
Thank you very much. I think we need to end now. I would like to take this opportunity to thank all of our eminent speakers for the excellent presentation, despite some difficulties, and then thank our co-chair, Dr. Nobuhiko Okabe, who has done his best to control this symposium. Thank you, and hope to see you sometime. Bye.
Thank you. Thank you very much.
Bye-bye.
Bye.
Bye. Okay.